Life Management Science Labs would like to acknowledge that we live and produce this podcast on the traditional lands of the Wurundjeri people. We'd also like to acknowledge the traditional owners of the lands of our listeners and our international colleagues. We'd like to pay our respects to their elders, past, present, and emerging. Hello, everyone, and welcome to Sero Boost, the Happiness Science Insights podcast produced by LMSL, the Life Management Science Labs. We're champions of life management science, providing structured insights informed by science and inspired by practice on key aspects of conscious living. Each week, we bring you scientific and practical insights on each element with the expert knowledge of professionals in the field. I'm your host, Lu Ngo, coming to your ears from Narm, Melbourne, Australia. Let's learn together.
Hello, everyone, and welcome back to the show. Today, we are exploring anxiety, something everyone probably experiences in differing amounts during their life, but how much of it can we consider normal and when should we consider seeking help? Joining us today to explore the facts is our expert, Sean Chu. Sean is a psychotherapist, professional counsellor, and advanced certified clinical trauma specialist based in Singapore. With a foundation in nursing and extensive experience in both clinical and therapeutic settings, Sean specializes in trauma recovery, mood and anxiety disorders, grief, relationship challenges, and identity struggles. He adopts an integrative therapeutic approach, providing personalized care tailored to each client's needs. Sean is also trained in multi-channel eye movement integration, a trauma-focused modality that combines eye movements with neurolinguistic programming techniques to support recovery. Currently pursuing a Doctor of Psychology in Clinical Specialization, Sean serves as the Medical Partnership Director at Holistic Psychotherapy Centre, where he fosters collaborative efforts with healthcare providers to enhance client care. An active member of the Singapore Association for Counselling and Singapore Psychological Society, he also volunteers with social enterprises to extend mental health support to undeserved communities. So, welcome to the show, Sean. It's great to have you here today.
Thank you so much, Sarah, for having me here. It's my honor to be here to share about this topic about anxiety as well. Thank you.
Amazing. I'm excited to hear more about it. It's definitely something that comes up a lot, but I feel like people don't really know that much about. So, before we get into the topic, though, we'd like to get to know you a little bit better in terms of your career. So, tell me, what compelled you to study psychology?
All right. So, what compelled me as to study psychology brings me back to when I was a case manager in a mental health clinic, where a client actually called in and tell me a very detailed suicide plans, basically from the what time that he wanted to commit suicide and to the medication and the mood that he want to use. And at that point of moment, I just used what I was taught back in nursing, but I know that I lack the skill set to actually move more, right? And thankfully, the client actually came to this clinic to see the psychiatrist and at the end received treatments in the hospital. And that was the move that made me decide, okay, well, I need to go for further training on it. And that is where I am today.
Wow, that's an amazing story. I'm so glad that you saw that there was a need there, something that you didn't know, and decided to pursue it. So that's really exciting, and I'm glad that I'm sure that you're happy now in the field that you're working in. Yeah. Amazing. Well, we'd like to get to know you a bit better as a person. So, this is our segment, Have You Met Sean? I'd like you to answer these questions in just a few words, like a quick fire, icebreaker kind of
Sure,
section. So, first of
sure.
all, do you have a favorite book?
Yes, I do. And the book is actually, I think, quite commonly in the field, which is The Body Keep the Score.
I've heard of
Yes.
this. Yeah. Do you have a movie that you've enjoyed recently?
Okay, no, I don't really have a movie that I enjoy recently, but there is a drama that I enjoyed recently actually. It's a Taiwanese drama called The Forget You Not. Mm,
Nice title. That's cool. And
yes.
are you listening to any podcasts at the moment?
Okay, podcast, I listen to random podcasts that
Mhm.
based on topic, but my preference is still reading, basically.
Yeah, of
Yes.
course. And do you have a role model either in your personal life or professional life?
I will rather say that my role model is my mom at home,
Mm,
right? She's more than just a mother to me, but someone who has shows love to her children through her actions, even though she's going through challenges while raising up the four kids.
yes, mums are so amazing.
Yes, it's
And
a super lady.
Yeah. And is there a class or a course that you've taken that has really inspired you?
Yes. So the course that inspired me up to today is actually my trauma course.
Mm.
That one key takeaway from this course is about attunement. Right? As a therapist, it is very important for us to be self-regulated before we even help our clients to navigate through their challenges.
Yeah, amazing. Well, thank you for sharing so that we can get to know you a bit better. We'd like to now dive into our topic of anxiety and find out what's normal and what's not. So, just to begin, let's get some definitions out of the way. So, what would you say your definition is for happiness?
Okay, to me, happiness is not just the absence of problems, but the presence of self acceptance and also the connectedness and the ability to be present, right? And a powerful quote that I always hear is about the present moment is filled with joy and happiness. If you are attentive, you will see it. So it just speaks so clearly about happiness is that happiness is always there, but it's just us ourselves to just pause and simply noticing. Yeah.
Yeah. That's so interesting. I've actually just recently listened to another podcast that touched on that idea. People are so often waiting for a big achievement and they think, oh, I'll be happy when I've done this. But actually, we can notice happiness in the present moment, not just when there's like a big good moment, but actually in the mundane everyday, we can notice happiness. Yeah. So I love what you said there about the present moment is filled with happiness and you just have to notice. Yeah. Yeah, I've definitely been exploring that myself. So, next up, what is your definition of anxiety?
For anxiety wise, for me, my own simple explanation is just our mind and body alert system where it warns us of potential threat, basically. Right? When when there is some our heart started to race and also our muscles started to tense, these are just our body signaling, telling us that there is a potential threat that is coming, basically.
Yeah,
Yeah.
absolutely. So, how would you say that happiness and anxiety are connected?
Hmm. Right, rather, I would say that the effect of anxiety are often help to disconnect us from joy and also meaning. It naturally narrow our perceptions, right, and pushing us into a survival mode, basically, right? Yeah,
Yeah, that's a good answer. It definitely makes you blind to sort of what's going on
yes,
around you in a way.
that's right.
Yeah.
That's right.
And next up, what is the difference? And I feel like a lot of people maybe struggle with this question. What is the difference between stress and anxiety?
Right, and I think that is a very common question. Even
Yeah.
during my therapy session, a lot of people ask. So to me, stress is often situational, and it just passes away once the trigger is gone. Right,
Mm,
such as examination in my university. Once the semester ended, the exam over, that stress gone.
mm.
However, anxiety is actually lingers around often without a clear source. So if I were to say is anxiety can be situational or general, but often the time anxiety is long term, where stress is usually situational and just short term.
Yeah, definitely. That makes sense. And great that I'm sure you have to explain that all the time. So you have a very clear explanation.
Thank you.
So, diving into some deeper questions now,
Mm.
when do feelings of anxiety become abnormal or more than the norm?
Right. And I always will say is that no matter is it anxiety or just mental health per se,
Mm,
as long as it started to affect our daily life, such as our eating, sleeping habit, or even relationship, all right, and we start avoiding situation out of fear, then
mhm.
that is, in a way, I will use the inverted comma, abnormal.
Okay, yes, this makes sense. And so, what then is the difference between anxiety or experiencing anxiety and an anxiety disorder?
So, in order to know what is anxiety and what is anxiety disorder, we have to look into the diagnostic and statistical manual of mental disorder, which is DSM, where we
Yeah.
use. So, anxiety is often become a disorder when the symptoms persist about 6 months or more and have significant impact on our social, occupational, and personal functioning.
Yes, this makes sense. Okay. So, at what point should somebody seek help for their anxiety? And at what point would somebody potentially be diagnosed with an anxiety disorder?
I think that is also a very good question as
Mm,
well, right? And to me, it's the time of rule is whether is it anxiety, once again, anxiety or mental health disorder, As long as we find, or myself finds, that I'm constantly exhausted by all these thoughts, avoiding people or situation once I enjoy, for example, playing games, or if my mind feels that, I'm just too much thoughts running through, basically, right?
Mm,
And I just cannot switch it off, basically. And
mm.
that is a clear sign that I need to reach help. Reaching help doesn't need to wait until things got blow up and I reach out. And reach help is also not a sign of weakness. Yeah.
Yeah, absolutely. So if somebody reaches out in that case and, they're seeing a psychologist or something like that, at what point would the healthcare professional consider diagnosing them with an anxiety disorder?
Okay. In my own personal sense, I usually would not go into diagnosis that fast
No.
unless there is really a need, right? And usually we will actually assess the symptoms and the situation. And based on the DSM, as long as more than 6 months and it really impacts the person's life, then that is where further action have to be done, such as referring to a psychiatrist for medication purposes.
Yeah,
Yes.
okay, this makes sense. Would you say that some people are more prone to anxiety than other people?
This question, I would rather say that everyone, include me, myself,
Mhm.
is prone. But however, based on research, people with certain genetic trait or even attachment trauma or even high environmental stressor are actually more prone to anxiety.
Right. So
Yeah.
are there then genetic factors at play?
Yes, definitely there are genetic factors that play.
Interesting.
Mm.
Okay. And how can we stop our anxiety impacting our overall happiness? Do you have any techniques maybe we can manage better?
Rather true to be said is that we may not always be able to stop it, to be frank, right? But we are able to learn some tool to help us to manage. So number one, such as breath work, so basically deep breathing exercise, or meditations, or mindfulness practice, or even grounding exercise, or reframing our thoughts. But of course, definitely, therapies will definitely help as well.
Absolutely. So I know that you have done some research and have done education, particularly in the area of trauma, and that this is particularly interesting to you. How might anxiety present itself differently for someone who has experienced trauma?
Yeah. So thank you for that question, right? Especially in a trauma survival, anxiety often show out in ways that goes beyond their everyday worry, right? And something that we observe in trauma survival is like flashback, hypervigilance, being very constantly edged on or even scanning the environment for any potential danger, and emotional dysregulation when their feeling became overwhelmed or even hard to control. So, for example, just imagine someone with a traumatic event, right? And even something as originally as, just a speeding car just walk past us, this person can be triggered a fear response so badly, actually. Yeah.
Interesting. Fear responses are triggered. So just almost out of something that the rest of us would consider such a small event, but it really plays into their mental health a lot deeper. I understand that. So how might a psychologist or a doctor, healthcare professional of some description, treat anxiety differently for somebody who does have that trauma?
Right. And I think this is also a very common question, especially in trauma work. So
Mm,
to me, when I work with my clients with trauma, the key main focus is to establish safety, right? And it's only establish safety through, somatic work or even grounding before any other therapeutic modality can comes in or intervention can comes in, right? Such as the trauma focused therapy utilizing a eye movement intervention.
interesting. I'm curious now. Is it difficult to establish that safety and that communication is safe with this person who's experienced trauma in your experience?
Okay, that actually varies between people from people, right? Different people, they comes into the room, they are, even though they can have the similar trauma experience, but their presenting is very different. So I would say some clients, they will need a little bit longer, like maybe about 1 or 2 session in order for that safety to be established. And importantly, it brings back to the point that as therapists ourselves, we need to be attuned and we need to be self-regulated before we even can help someone to navigate and also to establish the safety in the room.
Interesting. I'm really curious about how you're speaking about, what the therapist needs to do themselves in order to establish this. How do you stay self-regulated? I'm interested.
Okay, so for me, thank you for asking that question. So for me, usually I will tend to come into the therapy room, and I believe a lot of therapists in the world, right, will do the same. Come into the therapy room a lot more earlier, just to prepare myself. And for me, one technique helps a lot is mindfulness practice. So I usually tend to have a very quick mindfulness practice, just to basically put myself into the current present moment and just to focus, right? And also to always keep in constant check in myself as well.
Yes, good advice. Now, are there any differences in how the anxiety may present depending on if the trauma was experienced in childhood or in adulthood?
Okay, definitely it is a difference. So for childhood trauma tends to have a deeper and long-term impact because it happens during their critical stage of development, right? It shapes how a person see themselves and also how they relate to others, even how their nervous system learn to regulate stress. On the other hand, adults with trauma often react through the early imprint, such as unresolved fears, helplessness, or even shame. And adult trauma can also be distressing on its own and also can be very awakened by an early survival response that was never fully processed.
Interesting. So, how can we help our nervous systems to relearn how to regulate stress if we haven't, been regulating properly beforehand, especially if something traumatic was experienced in childhood?
So that is where therapists will definitely do a very good help.
Mm.
And some techniques that we do is like grounding, right? Like example, like touching a bottle, just to ground yourself into the present moment, and also mindfulness practice and breath work. These are all techniques where it helps the individual to stay at the current present moment where they to inform the nervous system basically that look, you are no longer in threat anymore. And that is where establish of safety is very important.
Yeah, interesting. So, in the real world, how can friends and family and partners be a support to somebody who does have anxiety?
And frankly speaking, I just received a text message from a friend who asked me that same question.
Oh, wow.
Right?
That's
Yes.
good.
Right. So for me, I will say that to me, one of the most powerful things to offer to someone with anxiety is to be present without pressure. Right? Instead of trying to fix their anxiety or give advice right away, right? Just by just simply just validating their experience. For example, say some things like, oh, that sounds really hard on you, right? But I'm here with you, right? That this build the emotional safety, because often the time anxiety often make a person feel alone or even misunderstood. And being consistent, calm, present, especially during the moment of overwhelming situation of that person or your friends, can actually goes a very long way.
Mm. Are there any misconceptions? What I want to ask here is I feel like there's a lot of things that people could say or want to say to somebody that is experiencing anxiety that they don't realize is actually unhelpful. And they say something and they think, oh, I'm going to help calm this person down, and it doesn't help. What are some of the common things that people try and say? And what can we say instead that is actually helpful?
So some of it that people tend to say is that get out of it, get out of the room, right? You will feel better, right? But often the time I will use the metaphor as a sunglasses, right? They have a sunglasses in front of them that they literally just see everything black and white, right? They are not able to see color as what we are right now seeing things is in color form, right? And doing saying something that get out of the room, you need to move your body, stop lying there, actually it's not helping at all, right? So being present with them, and some people they tend to straight away go and hug. It may or may not be helpful. So when you want to give a hug, it's always good to ask the person is that, you know, is it okay if I just give you a hug?
Mm,
And just hug. And if he or she responds is, yes, sure, then you give a hug. A tight and firm hug. That is the
mm,
most important. Not just simply just hugging and that's all.
yeah. What would you say to people who, I've had many experiences being in both positions as somebody wanting to help and somebody wanting to receive help around an anxious situation. And I often find myself not knowing what will help. So, for example, somebody will ask me, "What can I do to help you in this situation?" And I honestly don't know the answer, or the other way around, like I will say, "What can I do to help you?" And that person won't be sure. Is there anything that you would suggest, like, might be helpful if the person who's anxious doesn't actually know what they might need?
Hmm. So one important, I mean, thank you for bringing this up, right? And one important thing is it's important to look at the person, especially if the person is kind of like breathing a little bit fast.
Mm.
So what you can do is just to, guiding him or her, say that, okay, shall we just do a very simple breathing exercise, right? Just follow me. Let's breathe in and breathe out through your mouth, right? And even offering a cup of warm water and say that, hey, look, let's have a cup of warm water, right? It may helps you, right? Or maybe it says that, do you want to hold on to my hand, right?
Mm.
And let's say, I mean, whether or not we like it, sometimes, especially spiritual religions does help as well. So, like,
Mm.
if you're a Christian, shall we pray together, for example? Yes.
Mm. Very true. Interesting. Are there any resources, kind of on the same track here? Are there any resources you'd recommend to people wanting to manage their anxiety? And similarly, any resources for friends and family who want to help?
Yeah. So I would just recommend a few, right?
Mm.
And there's a book by Catherine called The Rewind Your Anxious Brain, right? It's actually a
Mm.
very good book for both people who wanted to help and those people who want to just understand a little bit more, right? And also application that we can download in our iPhones or even our Android phone, such as Insight, Timer, or even Calm or Headspace. These are actually some mindfulness uh, applications that we can download for free. No need to purchase any internal item that just help us regulate ourselves to stay in the current present moment. And mindfulness is one of the things that it helps me, not just my personal life, but also my professional life as well. Yeah. And oh, one more thing. So sorry. One more
Yeah.
thing. And one more thing is that people can also take out mindfulness courses, right? And for example, the mindfulness courses that I took from the Center for Mindfulness in Singapore, it also helped us to keep us regulated and keep us in the current present moment.
Interesting. I will make sure that I link all of those resources in our show notes so that listeners, you can go and find them and have a look for yourself. So, we're now going to move on to our break segment. This is going to be questions from the internet. So, I have some questions from people on the internet about anxiety or anxiety related issues. And hopefully, can answer their questions or give some advice relating to these
I will do
things.
my best.
Okay.
Yes.
I am kind of putting you on the spot with these ones. They're a little more random, a little bit less
Sure.
general. Let's learn about anxiety questions and more answering very specific people's problems. So we'll see how we
No,
go.
sure.
Um, so the first one, this person asks, how can I deal with morning panic attacks? Often I wake up and I'm panicking before I even remember what my name is. This morning was difficult. I managed to make breakfast and eat, but afterwards my heart was racing. Is there something I can do at night to make the next morning a little easier, or should I just take medication as soon as I wake up? What would you suggest for this person?
Okay. I will try to keep it short, basically, right?
Mm-hmm.
Waking up in a panic state or anxious state, right, can feel very disorientated, right?
Mm.
And I would rather say that you are not alone on this, right? Because what exactly happens in our nervous system is that it's already heightened before we even fully gain consciousness, right? And sometimes something that I would suggest, number one, is a nighttime routine, right?
Mm.
Try winding down yourself with practice that signals safety to your body, right? Such a gentle stretch at night. No need to do a major stretch. If not, you will be more awake actually,
Yeah.
right? Right, just a gentle stretch or just do journaling, right? Or even apps that I mentioned earlier, like inside the a timer, or a soft calming music at the background, right? Soft calming instrumental music specifically, right? Or even mindfulness to help to shift our system into a rest mode. And when we wake up and try to do a very simple grounding technique before even we reach out to the phone or even get out of the bed, right?
Mm.
Basically, place one hand on your chest and one hand on your tummy or your belly, either way. Just breathe in slowly in and out, you know, noticing the rise and fall of the chest and also your belly button, and also naming 5 things that you can see in the room or even hear. For example, I see my bed, I see a clock, I hear car moving around. And for medication wise, it can be helpful for some people, but I would rather say that always check with your primary doctor before taking any forms of medication. Yeah.
Yeah, definitely check on that. That's very interesting. I like those suggestions, and they could also be done in the morning, I suppose, when
Yes.
you wake up.
Definitely.
Stretching, journaling, just making
Yes.
sure that your
Yeah.
body feels you're in a safe place.
That's right.
But good advice to do it at nighttime and prepare your body for feeling safe as well. So the next person asks, this is about health anxiety. This person says, ever since I quit vaping, I've always been scared for my heart health for some reason. It's been 5 months since I quit, and I always think there's something wrong with my heart or that I'll go into cardiac arrest. How can I overcome these thoughts?
Okay, actually, this is very common, right?
Mm,
Not just for vaping or any forms of, as long as we have a big life or rather big health changes, right? And some practical steps we can do is basically a body scan meditation, basically helping us to differentiate the real symptoms versus anxiety. And body scan meditation, we can actually go to YouTube and just find a very simple guided meditation to help us through. That's one. And number two, journaling those anxious thoughts, right? By a rational response. So, for example, I'm afraid this chest pain means something serious. We can respond in a rational way, such as, I had this before, it has passed, I feel safe right now, and I know what to do to calm my body. And third, very important, which often people will do, is Google.
mm,
Limit the Google search actually, right? Because when we search more, we tend to be biased in terms of we take those symptoms associate to us. Then we start to think, oh, I got this, I got that, I got this, I got that. So limit the search button. And of course, when I shared much more earlier, especially when we started to feel exhausted by all these thoughts, avoiding avoiding situations or even a relationship, then it is time for us to actually seek help.
mm. Interesting. I always find journaling is a great suggestion because if you have sort of an irrational thought, you can write it down. And sometimes just that will make you realize that doesn't seem right, that there's something not rational about that. But also, if you journal regularly, I feel like it would be really helpful to be able to look back on things you've written before and see how your perspective has changed over time.
That's right. And the achievement that you have achieved, that's the most
Yes.
important. Yes.
Yeah, absolutely. Being
Yes.
proud of yourself that maybe
That's right.
journaling is really helping you. Yeah.
Yes.
I have one more question from the internet for you.
Sure. No
When
problem.
does overthinking turn into anxiety? Overthinking tends to stay in the mind, but anxiety shows up in the body, shaky hands, fatigue, or a sense of panic. The transition isn't always clear. What helps you recognize when it shifts?
Okay. So I think that is a very good question. And often the time, overthinking and anxiety actually overlaps. Right. As you
Mm,
mentioned that overthinking tends to stay in our mind. It's just like, a replaying of a particular situations. Right. And however, anxiety, it actually keeps it just our body will speak it up. Right. It
mm,
includes signs like tightness in chest or even trouble sleeping. So one important thing is I always will still go back to what I've mentioned, which because to me it helps a lot, especially with my client, which is grounding, breath work, or even stepping outside of the loop, right, is actually very important. So something that we can do is basically, if we realize that we keep overthinking, right, one thing we can do is just, okay, I will just leave this room, for example, I'll leave this room, just have a walk in my living rooms or in my gardens or in my corridor, just a very short one and come back again. Some people, what they can do is just basically go and have a shower to keep
mm.
themselves fresh again, basically, rather than just sitting and just continuously, I will use the word derailing in those thoughts. Those things just to distract ourselves is actually can help a lot.
Yeah, interesting. Okay, so we're now going to move on to our practices and habits segment. What is a habit that you would recommend practicing to manage anxiety?
Okay, one of my goals to practice will be a 5 4 3 2 1 grounding
Hmm.
technique, right? So I think a lot of people will hear that it's basically 5 things that you can see, four things that you can feel, three things that you can hear, two smell that you can smell, and one taste that you can taste. Right. Yes.
Mm. And what are some really good things about this practice? What does it achieve?
Okay, so it actually help us to stay in the current present moment, and it actually help us to calm our body, right? Especially during anxiety or even trauma cases, right? Often the time the body is at the fight and flight response, right? Because it's of the potential threat that might going to happen. And using this technique actually helps us to maintain at the current present reality that look, everything is fine, everything is okay, right? Yes.
Mm. Interesting. Do you find that do people have any challenges when they do this practice? Does anybody find it difficult for whatever reason?
Definitely for sure.
Mm.
Yes.
Okay.
Yes. So one thing I would say is that practice makes things perfect. And I would say that especially in the startup, right, it will never be easy. That is always I tell my client. Like it will never be easy. But give a try. Right? You no need to straight away do okay, find things that you see or grounding technique, breathing technique, everything at one go. But
Mm.
whichever works for you. Right. And usually I will say that start small and we slowly move up. That I would rather use the word, lack of a better words, the intensity move up, right? More things that you do to help yourself cope with these things.
Yeah, interesting. And do you find that you tell people to do this like once a day? How often? And should somebody set aside a certain time to practice it?
Okay. I will not specifically say that, okay, you must, like do 3 times a day, 4 times a day, like a prescription of medicine, right? But I think one best thing is do it before we sleep and do it before we wake up. Right?
Mm.
And in between of the days that you realize that anxiety started to kick up. So sometimes I will actually give my client anxiety chart where they will actually pop the chart basically from 0 to 5. 0 basically no anxiety and 5 is the most anxiety. Right? And putting the chart, helping them or helping us to identify where we are and what are some things that we can do to lower the anxiety rather than continue letting it going higher and higher and higher. Yes.
Would you recommend this practice to everyone, or is there anyone you would say shouldn't do it?
Okay, I will not say that no one no need can do need to do it because this is basically just a technique or a tool to help us keeping ourselves in the current present moment, be it whether you are stressful, you are anxious or not. Just keeping us at the present moment, and that is where we will notice more little things about, yeah, today I actually managed to catch the bus on time, go to work on time. And that is something that, yeah, I feel blessed in a way,
Mm.
right? Because these are something that we will not be noticing until we paused and we noticed it. Yes.
Interesting. So, if people are doing this 5, 4, 3, 2, 1 technique and they're finding it helpful, are there any other techniques that you would recommend building on?
Mm. So one of another thing is breath work and
Mm.
also being in nature, right?
Yeah.
So for me, I love the beach. I love to hear the sea breeze, right? And because it just helps me to relax my whole body, right? And also doing some movement. Some people they actually go for exercise. Some people go for their basic walk. Not necessarily I need to exercise for an hour or so. Just a simple walk around my neighborhood for about 15 or 30 minutes is more than good enough.
Yeah. I've definitely found that has helped in my moments of, anxiousness or stress. I love going for a walk and just getting out somewhere else that I can just disconnect for a bit. It's really helpful. So now we're going to move on to the open mic segment. This is your chance to talk about anything that you're passionate about. It doesn't even have to be related to what we've been discussing so far, but it can be. So the floor is yours.
All right. Thank you so much, Sarah. So for me, I will say is that, something to me, mental health that has not has always been there for everybody, right? And mental health itself is not something that is weak, a signal of weakness, but a signal that we just need some support, right? And something that I'm very interested is especially, I mean, being a trauma specialist, trauma work, right? And especially seeing this word called advanced childhood experiences, how does this actually contribute or linkage to our health outcome, basically? Yeah.
Mm, interesting. I have a question, a bit of a random question that I've realized recently that talking about mental health with others is quite difficult for me because I feel like there's a stigma. How can we talk about it to other people, maybe people who don't know much about mental health, in a way that they can understand and be sympathetic or empathetic towards instead of kind of blocking it out. I'm not sure if this makes sense, but how can we start to try and break the stigma about talking about mental health?
So one thing that what we can do is the awareness,
Mm.
right? And if we're not sure about anything, even I myself, right? Sometimes I'm not aware about certain issue, right? Or certain condition or certain issue that my client presented. I search it up, talk to someone, find it out more, right? It's only building that awareness within ourselves. That is where we will feel confident or feel much more comfortable to speak about the topic about mental health, right? And it's not just, in especially in the place that I live in, Asia, especially or any other world, mental health, this topic is often being shunned.
Mm.
Often says that, oh, it's the taboo, it's something this and that. But
Yeah.
the more we shun, the more we don't talk about it. And the more we don't talk about it, the more there is no awareness about it. Yes.
Yeah. I was going to ask you that actually. What's it like where you are? Because you're in Singapore, right?
Yes, that's right.
I feel like it's a little bit of a taboo everywhere, but I think some
Yes.
cultures have it harder than others to talk about mental health. What is it like in Singapore? I have visited Singapore once, but I don't know much about it.
Yeah, I mean, welcome to Singapore again, actually. Although Singapore is very warm, right? But one thing I think Singapore culture, at least on my end, my understanding, is
Mm.
that because of a lot of culture background, right? And
Mm.
also our growing up, a lot of time mental health are linked to spiritual, right? For example, oh, because you do something bad, therefore, so and so is hunting you, basically, right? And they often at times they go into spirituality, healing. I mean, that is not wrong. That is not wrong. But however, we also need to broaden our perspective, broaden our mindset that look, mental health is actually real. It can happen to anybody, right? And to be honest, every one of us who hearing this podcast at any time experience certain mental health issue. Example, feeling very low from a breakup of a relationship or an exam result or even a life challenge. We do. But it's how we get out of it. And I will usually say that mental health a lot of time is about how we adapt to situation. And going for therapy or talking to someone is actually simply just seeking help. And that is actually a very brave movement. And going to someone with courage, you bring out so much of courage just to go and find out a little bit more about yourself, just to understand about yourself, and learning certain tools to help yourself. And often the time, not so much client learn from me, but I learn from my client a lot, actually.
Oh, yeah, that's great to hear. Learning from clients, learning from patients. When doctors and healthcare professionals come on to this podcast, or I just hear about them online and they say, I learned something from my patient, I'm always like, that is so amazing that your profession allows you to continue learning all the time. It's so cool. So we are going to conclude our podcast now. I have learned so much from you, and I hope that our listeners have as well. It's certainly a very important topic to talk about. So thank you for sharing all of your really insightful answers with us. If our listeners want to find out more about you and more about your work, where should they go?
Okay, so they can find me at my company website, which is Holistic Psychotherapy Center, and also on my LinkedIn as well. Yes.
Amazing. I'll make sure that we link those links down below in our show notes, and also the resources that you mentioned earlier in the podcast. I will make sure that those are linked as well, and anything else you want to share so that our listeners can go and find them if they want to have a look at those resources or look into you as a person and your profession. It's really interesting. So thank you again for being on the podcast. I've certainly learned a lot. And to our audience, I hope you have learned just as much as me. Thank you for tuning in, and we'll see you in the next episode.
Thank you so much.
You have been listening to Sero Boost, the Happiness Science Insights podcast produced by the Happiness Science Labs, a division of LMSL, the Life Management Science Labs. More episodes are available from 10 life management perspectives and can be found by searching LMSL on Apple Podcast, Google Podcast, Spotify, YouTube, and other podcasting apps available on your devices. If you enjoyed this episode, please rate, share, and subscribe to our channel so that other people can find it and we can continue to provide quality content. More of our work can be found on our website, ha.lmsl.net, where you can join our movement. I'm Lu Ngo. Thanks for tuning in.